Hello, my name is Abigail Cardoso and I'm an optometric technician. We usually do a few tests for the routine eye exam, but a few of them consist of the visual acuity test and a non-contact tonometry test. In the visual acuity test, we ask patients to identify different letters on a printed chart from a certain distance away, usually 20 feet. And this procedure tests for how clearly the patient sees, and normal results can be 20/20 vision. 20/20 vision and 2200 or worse may be indicative of an eye condition. In the non-contact tonometry test, we measure the eye pressure, the pressure inside the eye, by not touching the eye, but instead using a puff of air to flatten the cornea. The procedure tests for glaucoma. Results range from 10 to 21 millimeters of mercury. Those are considered normal. Abnormal results include anything higher than 21 millimeters. To go into more specifics, anything higher than 21 millimeters is called having a condition called ocular hypertension, which increases the risk of developing glaucoma over time. Anything higher than 27 millimeters indicates a high risk for developing glaucoma or already having glaucoma. Thank you for your time, and we'll pass you on to your next doctor.
Hi, my name is Matthew Boyser and I am an optometrist. Optometrists are the main eye doctors that you go to receive a routine eye exam. Our main jobs are to examine patients to diagnose any eye diseases or vision problems. To go in specific, some things that we test are depth perception, color perception, and image focus. And from those diagnoses and examinations, we are able to provide any treatment from the eye problems that have happened or prescribe eyeglasses and contact lenses. So for example, if a person is seeing white spots constantly throughout the day, they would come to an optometrist and the optometrist would perform a routine eye exam and any further tests that they would want to test. And from the results, they would be able to diagnose any disease or damage that the eye has endured. So an example of a test that would occur in a routine eye exam is a peripheral visual field test. And what it tests is vision loss and multiple blind spots in an individual's peripheral vision. And how this test works is a patient would rest their head on a chin rest inside a machine called the Humphrey Field Analyzer. The patient would then look at a light source straight ahead in the machine, and then the machine would start to produce light spots with different intensities that would be repeatedly presented in different areas of your peripheral vision throughout the test. And the patient's job is to just signal whenever he or she sees the different light spots to the doctor. And depending on how many light spots you see, the test can detect the severity of the optic nerve damage in your eye. And of course, the more loss of peripheral vision means that there is a larger damage to the optic nerve. This damage occurs due to glaucoma, which is tested by the non-contact tonometry test mentioned before.
Hi, my name is Lynn, and I am an ophthalmologist. An ophthalmologist is a medical or osteopathic doctor who specializes in eye and vision care. Ophthalmologists differ from optometrists and opticians in their levels of training and in what they do to diagnose and treat. As a medical doctor who has completed college and at least 8 years of additional medical training, an ophthalmologist is licensed to practice medicine and surgery. An ophthalmologist diagnoses and treats all eye diseases, performs eye surgery, and prescribes and fits eyeglasses and contact lenses to correct vision problems. Many ophthalmologists are also involved in scientific research on the causes and cures for eye diseases and vision disorders. Ophthalmologists perform routine eye exams and are trained to detect, diagnose, and manage eye diseases like macular degeneration, cataracts, or glaucoma. Some ophthalmologists specialize in certain diseases or conditions, while others choose a more generalized practice, handling a wide variety of eye issues but referring especially difficult cases to a specialist. For example, if a patient has blurred vision, cloudiness, or maybe can't see vibrant colors as before, then they could come to see me for more advanced care so I could diagnose them. A test I could do on a patient is a slit lamp examination. A slit lamp allows to see structures of the front of your eye under magnification. The microscope is called a slit lamp because it uses an intense light slit to illuminate your cornea iris, lens, and the space between your iris and cornea. The slit allows your doctor to view these structures in small sections, which make it easier to detect any tiny abnormalities. Depending on the results, if light appears differently, the patient could have a cataract, because cataracts are the type of diseases to make light from the sun or a lamp seem too bright or glaring. Or you may notice when you drive at night, the oncoming headlights cause more glare than before. Depending on the results, I may suggest considering cataract surgery when your cataracts begin to affect the quality of your life or interfere with your ability to perform normal daily activities, such as reading or driving at night.
Job description for an optician is that they interpret prescriptions given to them by the optometrist. They design, fit, order, and dispense frames or any other type of optical instruments needed for the patient that helps correct the patient's eyesight. The main point about opticians and the difference between them is that opticians don't give tests or prescriptions. All they do is basically just advise which types of frames or lenses would be best for the patient, such as the size, weight, style, color, or any other practicality abilities for it. And also, when the glasses come back, they check it with the patient to make sure that it has all the specifications needed for the patient. So a refraction assessment is a test that takes the measurement when the patient is evaluated for glasses. It basically determines the best corrected vision, which is the best vision with glasses. These results are then taken directly to the optician for the optician to find the lenses for it. The lens's powers is needed to compensate for the refraction error in the eye, which is basically examples are like myopia, hyperopia, and astigmatism. So the procedure for this starts with a phoropter. The optometrist takes the phoropter, which are basically lenses that test each individual eye, and it's basically like a mask, like big glasses, mask size, with knobs and wheels that the optometrist turns in order to find the best and clearest vision for you. So the optometrist shows a series of the lens choices. For example, if she says 1 or 2, and if you think 2 is clear, you'll then say 2. After that, she'll say 2 or 3, and if you still think 2 is clear, she'll then say 2 or 4, and so on until the most accurate vision is recorded. And this overall determines the combination that results in the most sharpest vision possible. So these measurements are the most accurate prescriptions for your. So there was this old woman once who came in. She was in her 60s or so. She was really into 70s fashion, which comes into play later. After I got the results of her eye number prescriptions for her from her optometrist, I read that she had myopia, and her vision was -4.5 on her left eye and -4.75 on her right eye. And whenever she came to me, we talked to each other to advise about which frames would be best for the other. So she was really into the 70s fashion, right? So she really wanted one of those really thin and hot pink glasses that had the oversized circles in the front. I checked her face and saw that the fit was good. There was no problem with that. So then I just ordered the correct lenses, which were the numbers, and it took around a week or so for it to come back. And she came back a week and a half later, and after that I got the glasses out and I put them on her, and I checked to see if the glasses fit her and she could see correctly. And there were no problems with it, so I just sent her on her way home.